Eric, there are some opportunities.
Yeah, actually, a lot of employers have already taken advantage of some of those. There was $5 billion that was issued for employers to continue their pre-65 retiree program. So a lot of employers benefited from that opportunity. So I guess the point is healthcare reform, like you said, isn't just a disaster. There are so many things within reform that can improve the way we do things today. That's just one example. The post-65 group, they're being supplied tons of subsidies from the drug manufacturers. Employers are now taking initiatives with their programs to make sure they're capitalizing on the subsidies that are available in the post-65 era. In the future, there's a 30% differential allowed to base your premiums on either some sort of wellness activity that you expect from your workforce, or they pay more, similar to car insurance. Right? You know, if your driving record's a little worse than somebody else, you pay a little bit more. The healthcare reform allows you to go up to 30% of the total cost. So that's a 50% increase in what's available today in terms of differential that's allowed. So that's a big opportunity out there in the future. Accountable care organizations. So Bruce talked a little bit about that. You're going to hear more. But these more integrated care delivery systems that have proven in the past to be much more efficient and lower cost, better quality than what we have today. And then what Ed and I are going to talk about is state-based insurance exchanges or federal insurance exchanges, depending on if the state doesn't put together a program or not. But the opportunity out there for federal money for your low-income workforce and how you might capitalize on that.
Yeah, and this is where the innovation begins to creep into the equation. But to understand that, you've got to understand a bit more about the box within which employers have to operate beginning in 2014. So we call it the employer play or pay puzzle. The law is going to require all but the smallest employers in 2014 to offer their full-time employees, and the law defines that. You don't get to define that. The law does. It's anybody working on average about 30 hours or more a week. You've got to offer those full-time employees and their dependents qualifying coverage. I'll talk in a moment about what qualifying coverage is. It's a little bit more robust than the minimum essential coverage somebody has to have to avoid the individual mandate penalty. And that offer of qualifying coverage must be considered affordable. Now, here's a little twist in the scheme. Although the employer has to offer coverage to the employees and their dependents, and it has to be qualifying coverage, the affordability standard simply says the offer of employee-only coverage has to be affordable. And that affordability standard is 9.5% of W-2 pay. As long as your employee-only rate doesn't exceed 9.5% W-2 pay, you'll be considered okay. Let's talk for a moment about this notion of qualifying coverage because it's important to some of the opportunities Eric will talk about, some of the innovative opportunities here to save some money.
Back to the pizza slice, right?
Yes.
Yeah.
The minimum essential coverage is the pizza slice. It's the bare bones minimum the person has to have to avoid the individual mandate penalty. The employer has to offer something a little bit more than that. It's minimum essential coverage that satisfies a minimum actuarial value standard. And there, Eric...
About half a pizza.
Yeah, and with toppings. It's a pizza with toppings. Yeah, and it's that difference is where the opportunity lies for some employers, and Eric will explore that in a moment. So, the multi-million-dollar question for employers in 2014 is, do I continue to play, and most employers think that they will, or do I pay? Well, what happens if they say, I'm not going to play anymore? I'm willing to pay to get out of this. What do they pay? If you get out entirely, you pay $2,000 non-deductible times all your full-time employees. You get to ignore the first 30, but it's essentially all your full-timers times $2,000 non-deductible.
So what can happen is your current spend, everybody thinks, by the way, every time I go to anywhere and talk about healthcare reform, they're like, why wouldn't we just get out and pay the $2,000? Well, a lot of employers have people that they're paying $7,000 for because they're enrolled in their coverage. But they also have a lot of people that they offer coverage to, or possibly don't offer coverage to, that they pay zero. Okay, so depending on the mix of zeros and 7,000s, you could actually spend less than 2,000 times your entire workforce.
If you decide to play, it's possible that perhaps your offer of coverage simply isn't either qualifying or maybe it's not affordable to some employees. That affordability calculation is an employee-by-employee calculation. And the penalty then is going to be $3,000, non-deductible, for every one of those employees who doesn't get an offer of qualifying and affordable coverage from you, but instead goes into the insurance exchanges and buys coverage there with federal money. It's the federal government saying, hey, we've got your employee over here in our exchange. We're giving him or her federal money to buy insurance because you're not giving them an offer of qualifying and affordable coverage. You're going to pay us something for that effort. And there, too, there's an opportunity.
Spend $7,000 today, just like we discussed. Would it be better if I had somebody just go buy from the exchange and now I have to pay $3,000? So this is an opportunity if you're coming from the other end of the spectrum, if you will, from the opportunity.
You bet. Who is this opportunistic employer? It's what Eric really just alluded to. It's the employer who today is spending well north of $3,000 per full-time employee for coverage, or at least on a good chunk of their workforce. Because if you're way up there, that spread between the penalty and what you're paying today is your opportunity.
So one idea, okay, is, and I think this will bear out. If you want to get out, I think you're better to offer the pizza slice and risk the $3,000 than pay $2,000 guaranteed on everybody. A little bit of a roll of the dice. You've got to understand your workforce and how you might go about doing that. But that's kind of the concept of how the $2,000 interacts with the $3,000, which interacts with what your potentials are.
And there are other factors. I mean, you may feel like you need to offer a generous benefit package to attract and retain the talent that you want. We get that. But some employers in that space that are spending more than the penalty today on full-time employee coverage, this presents an opportunity. Who is a vulnerable employer? Well, that's your retail employer. That's your restaurant employer, your hospitality or your hotel employer, your low-skilled manufacturing, your amusement park employer, your golf course management company. Any employer that has a fair number of relatively low-paid hourly workers who either are not getting an offer of coverage today, or if they are, it's not very good coverage, or if it's decent coverage, they're asking the employees to pay a giant chunk of that cost. Because those, again, are your vulnerable employers, and the reason is your current spend on those employees is less than the penalty would be.
Yeah, can they go back a slide?
Yeah.
There's also nursing homes that we're seeing are struggling with this. But dangers, one thing we've discovered with the elimination of lifetime maximums, we're studying the impact that had on large claims over $1 million. So in the far right corner, it doesn't really fit with the slide. Sorry, I dropped it in on Ed's slide unannounced. But one major carrier with millions of lives of study, the number of claims over $1 million in 2009 was 9. In 2010, it was 9. In 2011, it was 15. So we believe that there's a trend in the industry. So when you say dangers and opportunities, it really applies to all employers when you deal with some of the legislation in healthcare reform.
The problem with the vulnerable employer is they likely can't maintain their status quo. That is, they're providing coverage likely to managers or the corporate staff and not the rank and file employees. There's a blind curve up ahead on healthcare reform. Behind that blind curve sits a non-discrimination rule. There's a moratorium on it now until the IRS issues the rules on how this is going to play out. But the rule is sitting there. It's part of healthcare reform. It applies to non-grandfathered healthcare plans. And it's going to pose a problem for an employer that wants to continue to offer coverage just to the highly paid, the store managers, restaurant managers, corporate staff, headquarters element, and not rank and file. But they can't play. They can't afford to provide robust coverage to all their rank and file full-time employees. They can't even afford to pay. They can't afford to pay $2,000 non-deductible on a good chunk of full-time employees on whose behalf today the employer is spending very little or nothing on benefits. So the key here is to search for the efficient and opportunistic way out of the bind.
The example we like to give is the retail example, because everybody says, well, it's not just retail. There's lots of industries that are like this. But an employer with 6,700 employees, 700 enrolled in their coverage. Either they don't offer it to their hourly workforce, or a lot of the times the hospitality industry, they offer it, but people just don't take it. Okay, so here's the math. You spend $5 million today. You get to deduct $1.5 million of that, so your expense is $3.5 million. You have three options. You could say they're out. Everybody keeps saying, oh, these employers are just going to get out. They're going to get out. That would cost them $13.4 million. That's a very big delta from what they're spending today. What they could do is they could offer qualifying affordable coverage, half the pizza. That makes them not have to pay any penalties. Their cost would be $7.5 million. So there's the idea around maybe possibly the slice of pizza, or maybe some combinations of pizza slices that have some people qualify, some don't, but an optimization program where they provide some coverage to some people, they qualify others for exchanges, and we think that could see some costs around $4.5 million. Either way, an employer in this scenario is at jeopardy with an increase in expense.
So here's our question to you, the audience. If you know, or if you have a sense as which way your employer is going to go, what's your employer going to do in 2014? Stay the course? Consider eliminating all coverage? Need to consider redesign, reevaluate some of this? Who cares? The Mayans were right. You see, the Mayans think that in 2012 the world comes to an end. I don't know why that's funny. And the survey says, yeah, that's interesting. But I think it's compelling because it suggests that we all understand there are some opportunities out there for us under healthcare reform. Once the rules become just a little bit better defined, we'll have a very, very good sense as to what sort of direction we can take. And Eric talked at the outset about your model, and he has some slides coming up shortly that will explore some of that.